Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great, Jordan. How are you?
Good. So today I want to talk with you about an eyelid lift procedure, also called the blepharoplasty.
Sure.
If you could explain who would make a good candidate for an upper or a lower eyelid lift and how those procedures happen.
Sure. So, one of the first signs of aging is around the eye. I think that's where we first see the aging process. And as we age, a couple of things happen. Our skin stretches, obviously. And the other thing is the eyebrow just descends a little bit. It drops a little bit. And as that eyebrow drops, unfortunately, our eye is in the way, and that can cause some extra skin to develop in the upper eyelid area. So I think one of the first signs of aging is skin or heaviness in the upper eyelid area. And that makes people look sometimes not only old, but makes them look sad or tired or sometimes even angry. So that's a very easy thing to rejuvenate with upper eyelid surgery. In the lower eyelid surgery, as we age, we get a little bit of skin laxity there as well, but also we'll get a little fat pocket that can appear. People call them bags. And that's something that would be treated with a lower eyelid lift. Often the first procedure people will investigate with the aging process is eyelid surgery.
So what sort of anesthesia would be needed for those procedures?
Sure. Yeah. So the nice thing about eyelid surgery, it's surgery that we typically do in our office. We have an office operating room. And it's something that we normally do with local anesthesia. Because we're working around the eye, I will often have patients take a light sedative just to make you comfortable. But I actually prefer to do these sort of things with local anesthesia because it's very helpful for the patient to be awake during the surgery. And that sounds a little crazy, but what it means is during the surgery, I'll have the patient open and close their eyes and do some things to help us along to gauge what to do. And if the patient's completely out, they can't do that. So I think we can do a better job with the patient just under local anesthesia. So these procedures are usually done in the office with local anesthesia.
And would you be able to explain to me exactly how an upper eyelid lift is performed? Are you removing pieces of the skin?
Yeah, so what we'll do is measure how much extra skin there is before the surgery, because the goal of the surgery is to remove extra skin to tighten that skin. So we have to leave enough skin so you can close your eyes, obviously. So we carefully measure how much extra skin there is. And then also during the surgery, many people have little fat pockets around the eye. In general, I think we try to leave fatty tissue because it's natural, but if they have extra, we'll remove a little bit of fatty tissue as well. And that really goes for the lower eyelid as well. So we carefully measure how much extra skin there is. A mistake is over tightening. You don't want to over tighten because that can distort the eye. So I think we try to create as natural looking eye as possible by not distorting things.
Great. Yeah. So for someone looking for a lower eyelid lift to help with just the bags under their eyes, they might not have loose skin there, but just extreme baggage. How would you do that procedure? Would they have incisions on the outside? So
typically, most often people do have extra skin on the lower eyelid area, and we'll make a little incision right beneath their eyelash to remove that extra skin. But occasionally a patient doesn't have any extra skin, and usually it's a younger patient, and they might just have some fatty tissue or bags. So what we'll do is we'll do something called a transconjunctival eyelid lift. And that means going in through the pink tissue around the eye. So if you pull your eyelid down, it's that tissue that you might see kind of around your eyeball. But anyway, the reason we would do that is there's really no scar. It's scarless. So we can go in after numbing the patient through that incision and just kind of pluck out some of that extra fatty tissue.
Yeah, that's great. So I understand that sometimes patients, their eyelids can kind of, once they've drooped and they have this extra skin, it can block their vision. Is there like any situation that could be covered by insurance?
Yeah, so sometimes eyelid surgery, at least upper eyelid surgery, can be covered by insurances. And it's typically the older patient who has lots of extra skin to the point where that skin is actually kind of hanging down and blocking your vision. And, the analogy I like to use is kind of like a horse pulling a buggy. They put blinders on that horse so the horse doesn't get distracted to the side. And sometimes people will walk around with a little blinder from that upper eyelid area where it's kind of hanging down and blocking some of their vision up and above. And people often don't even realize it. They tell me they watch TV and they realize they're kind of pulling their eyebrows up to get the skin out of the way so they can watch TV or read a book. So for those patients, the skin has become a medical problem, a functional problem where it's interfering with their vision. So in those patients, it is something that insurance companies potentially can cover. There's some hoops the insurance companies make us jump through to get things pre-authorized. Usually the patient does need to have some sort of specialized vision test that either an eye doctor or an optometrist might perform. But certainly our office is, very used to dealing with this sort of thing, and we're happy to send the patient in the right direction where they can get this sort of testing done to sort out whether it's something an insurance company might cover.
Yeah. So for those that aren't insurance cases, what sort of cost would be for an upper eyelid lift? Good
question. So typically an upper eyelid lift is in the mid $2,000 range, and that includes really the surgery and the whole process and the recovery. Lower eyelid surgery is approaching $3,000. It's a bit more expensive because it's a bit more complicated and time-consuming. Often patients will do both. They'll do their upper and their lower eyelids at the same time if they have problems in both, which is common. And the nice thing about that, it kind of just gets it over with all at once and with one recovery. Mm-hmm. And to do uppers and lowers, you're looking it's something in the low $5,000 range, including everything again, all the anesthesia and the recoveries and the follow-up visits and that sort of thing.
So what does recovery look like then for those procedures?
So actually it's a pretty easy recovery, I think. In this, the scheme of things, you have visible stitches. We get those out within a week. With upper eyelid surgery, there typically is very little in the way of bruising. Lower eyelid surgery has a little bit tendency to maybe bruise a touch more, but usually it's pretty minor. What I tell folks is usually within a week, the stitches are out. And then with a touch of makeup, they're probably back working or doing social things and that sort of thing. You do have to avoid aerobic things, strenuous things for about 10 days.
Okay.
Yeah.
All right, great. That's all we have for today then.
Okay, thanks, Jordan.
Thank you.
Great topic.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.